Cool. Yeah, it's cool. So if I just kind of like go with the questions and you kind of just interact, and
Yeah,
it's quite relaxed. So what we've been doing is just very informal, and you can kind of go off a little bit on a tangent if you want to.
Yeah, no, that's fine. That's what we've been doing. It's just doing more of a conversation, basically. If that makes sense.
All right, cool. So we're here today with. Do we go with Karl or Khalid?
No, go with Karl. It's fine.
All right, so we're here today with Karl, physiotherapist, and we're going to be doing a bit of a discussion on who he is, what he does, and how we can potentially bridge the gap between working with, or personal trainers working with allied health professionals, and also looking at some of the common injuries and conditions that people come to him with. So if you can just start, Karl, by telling us a little bit about yourself, so who you are, what you do, and how you kind of got to where you are now, so sort of your journey, if you like.
Thanks, Chris. So, as I said, my name is Karl. I'm the founder of Rebuild Sports Clinic. I also work as the kind of clinical lead for the London Back Pain Clinic. And so my background, I'd say, is I've worked with quite a number of sports teams in football and in hockey. And then I've worked in like the NHS for a little bit, and then I done a lot of work in the private practice, and I've kind of seen quite a wide variety of people in the industry. So people with long-term conditions, sometimes which is obviously the kind of short-term conditions, and people trying to improve their health or kind of start getting into kind of exercising more, or even sometimes people trying to just get back into it. So for me, working with a personal trainer is a kind of key component, because it kind of really kind of helps kind of get my patients, kind of really promote them to ease them into kind of exercising again, or even to advise me further on with their kind of treatment, if that makes sense.
Yeah, absolutely. So what was it that got you into physiotherapy?
Well, I guess both my parents were in healthcare, so I always wanted to be in healthcare, but I also had a love for sports as well. So so physiotherapy kind of really stood out for me in that way. And then I kind of looked into it a little bit more, and I thought, definitely I can help people, but also be in a kind of field that kind of interests me. I like how people kind of move, and I like to exercise and train myself, and it's always about with physiotherapy, is you can kind of work out kind of mechanically what's wrong. You kind of solving a puzzle, and I kind of use it for my own sort of training and things to improve myself.
Absolutely, yeah. So one of the things that we've highlighted all the way through this course is the kind of umbrella term of problem solver. So personal trainers, physios, chiropractors, whoever it may be, we're all problem solving for our clients and trying to find solutions. So just in case anybody isn't actually sure what a physiotherapist does, can you just tell us a little bit about what that means to you and how that kind of translates to your clients and patients?
I mean, me as a physiotherapist in the kind of private sector, or like as a musculoskeletal kind of physiotherapist, is basically our role is to get someone from point A, where they've come in with the injury or they've come in with some pain, to get them to point B, which might be getting them the goals. So sometimes it is getting rid of their pain from their injury, or sometimes it might be just getting them back to run, say for example 5k, or being able to get back into the bench press, or doing some squats, or doing what they need to do, getting their kind of improving their function, or their kind of their what's the word I want to say, their main task, if that makes sense. So
the thing that they do.
Yeah, the thing that helps get up in the morning, makes sense.
Yeah, so whether that's sport, or whether it's a particular activity, or particular exercise in the gym.
Exactly. And a lot of the time I see in the clinic where people are struggling just to do a squat or a deadlift, or the problem is running, and sometimes all it takes is a little tinkering or a small exercise, and off they go again.
Okay, cool. So where do you think personal training can come into this, and how can it kind of link in better with what you're doing? So tell us a little bit about what it's like at the moment, that kind of relationship, if it's there, and where could it be?
Well, so this is the thing, like I kind of really rely on personal trainers, okay, like yourself, and I think they're really kind of needed between physios and personal trainers. Okay, so firstly, you've got like kind of three different scenarios. So the first one might be that you've sent me someone, okay, and then you've given me, look, they've got this injury for the last 3 or 4 weeks and it's affecting our kind of program, and then it's kind of your job to kind of educate me on them. For example, what you guys have been doing, what's their kind of fitness goals, so we can keep them going towards their goals, you know, without having the physiotherapy to kind of stop everything at once. We kind of work with them and we work together, if that makes sense.
Yeah, no, absolutely. So one of the things we're trying to push is that multidisciplinary approach to having different people working with our various clients, but with that there's got to be a lot of communication between each of us, otherwise there's a bit of a disconnect there. And we've had conversations about this before where sometimes it can be a bit confusing if there isn't that communication to know what people are thinking, and you don't really know if the clients get anything out of it if they've seen several people, and it's just about talking and being on the same page.
Exactly. Which brings me on to the next step sort of thing, is like during my rehab, say for example, I will talk to Chris and go, Chris, like we are trying to strengthen the glutes up, so I was like, can you make the workouts, you know, towards their kind of fitness goals, but also have a little bit more on the glutes, okay, so we can also feed into that rehab, and so they get the point and they can see the difference.
Yeah.
And then the last thing that's really important between a personal trainer and a physio is a lot of people, they don't like exercise, yeah, and you know that, yeah, and it's hard to motivate people, but a lot of the time, it's like anything in life, is sometimes you need a little hand up from someone, a little bit of advice, have someone there as kind of a bit of comfort and motivation. So a lot of the time I use personal trainers to kind of get them into a gateway to kind of help themselves for the future, if that makes sense, get them more into exercise so they don't fear it. Because a lot of the time it's that fear and that anxiety, it plays a role of them not going to do it, if that makes sense, yeah? And then once they realise that actually this is not so bad, then you convince someone for life, really. You really can make a big difference.
Yeah, and I think a lot of it as well is about collectively making it so it's a safe space and environment, so they feel like they're actually going to get somewhere, because it can be quite daunting going to physio because people think there's something inherently wrong with them, or it's not about that, it's about, well, this is how you can kind of just develop on the situation that is there.
Which is a great point, because a lot of the time people think if I've got pain, that there's obviously something wrong, there's something injured, there's something torn, and if I do certain exercises or it makes it more painful, it's making it worse. Now a lot of the time that's not necessarily the case. Sometimes your brain just can be a bit overprotective. So sometimes it's that kind of education about, look, okay, yeah, we're not going to work to our normal 100%, but we might need to take it back off a little bit, do the 50% so we don't lose all that progress that we've made over the last couple of weeks or months or even years, if that makes sense, because obviously, as we know, you lose it a lot quicker you gain it.
Yeah, absolutely. I think the key thing with that as well is words that are used, so the language we use of our clients, so things like torn, pulled, sprained. Our clients don't necessarily know what it means, so they might say they've sprained their ankle and gone and seen a physio. They might have done that, but I found this a lot of the times with like people that come to me as well, like one guy will say he's pulled his plantar fascia, and I said to him, I don't know what that means. So when I've actually gone to the physio and found out, he's just got his wording mixed up and it means something else. And unless you have the conversation with people like yourself, we don't actually know what he actually did, because it can mean two very different things. And
which is one of the biggest and vital things when it comes to injuries, is communication is key. A lot of the times when, for example, people say that, oh, you might have a herniated disc, and that will make someone panic, and then it kind of gets in their head that there is something inherently wrong with my back, or and that can then kind of manifest into kind of more anxious, and then like kind of fear avoidance kind of behaviour. So it's really important with regards to communication with injuries. It's about educating, kind of calming the nerves. Generally, majority of injuries will have a healing process, and as long as you're not doing things that really aggravate it, and you do things that are more therapeutic, majority of the time you should be able to get through it.
Perfect. And what do you think personal trainers or fitness professionals in general can do better to kind of improve that communication and bridge the gap between?
I mean, personally speaking, it's like I would personally, if you are interested in injuries, if you are going to be personal trainers, I'd really recommend that, because my biggest thing is learn about injuries, okay, understand them, and they're kind of, and their kind of progress and what you'd like to see, sort of thing, and even get like a basic knowledge of the rehabs kind of protocols for it. Like for example, if you had an Achilles injuries, a lot of the time people feel they need to stretch it. In actual fact, a lot of the time it's actually doing a lot of strengthening work on the actual calf muscles itself, not necessarily the stretching, which a lot of people want to do. And sometimes actually stretching could be worse.
Counterproductive.
The other thing is that it's just communicating with with the physio, because, for example, like Chris has told me certain things about my clients about the way that they move that I didn't necessarily notice. So that means I can put into their rehab program, or their therapy, I can implement that into there to make it a lot more effective. At the end of the day, you're a team, so both your skills are in line with each other, and you've got a certain goal. So the more you tell each other and bounce it off, the better kind of end result you're going to get.
And I find that with I have a particular thought process is throughout your course as well. We're building a thought process from point A to point Z, and it might not be the same thought process as Karl's or someone else's that I work with, but what it's supposed to do is go, well, this is what I see using this, and then we try and align it up with what you see, which is using a slightly different one. But what you'll find is all thought processes, if they're done correctly, lead to the same point anyway, and it's just about understanding that so things can complement, because I might miss something and you'll pick it up, you might miss something and I'll pick it up, and it's not that we're necessarily wrong or right, it's just that we're using different skills and different tools to see what is going on with our clients. And I think sometimes there is a bit of a disconnect between allied health professionals and personal trainers, whether it's a trust thing or whatnot, but there's also, well, this is my way, I'm going to do it my way, and that can sometimes put people off.
And that's a big thing. That's even in our industry as well, because like I work with kind of manual therapists like chiropractors and osteopaths, podiatrists, and a lot of the time is that people want to keep, because they feel like they have the keys to solve this person's problem. So a lot of the time is that we want to keep them and let we feel like we need to solve this issue. And in actual fact, you're not doing anyone any favors there. Really, you leave kind of specialties to the specialists, and it's kind of a way of good way of professionalism. If you overstep your marker, you could be causing more harm than good, really.
Yeah, and it's all just getting it to line up. Again, every one of those thought processes and practitioners has value, and what they see might well be right within a certain context, but it's also, is it what's best for the client? And a lot of the time it's not, because even with things like insurance, you don't go through insurance to see a personal trainer, you will go through insurance to potentially go and see one of the other people. And a lot of it is also, well, it's sometimes easier for people to stay on insurance because they don't have to pay for it than it is to go and pay extra for a PT. So there is that as well, I find.
Yeah, that is the hard thing, trying to convince people to get to the next sort of level, going away from the physio, going to the PT, is sometimes convincing them this is going to be good for you in the long run. And that is something going forward probably should change in a way, because PTs do have do make my job a lot easier, and kind of really do help with that long term goal and keeping injuries away, and at the end of the day, exercise is key.
Yeah, absolutely. So I think my next point is really on, like, who's your typical, I mean, you probably don't have a typical client, but what, if you had 3 common injuries that people came to you with, what do you see the most of?
Okay, so 3 common injuries. I mean, generally like neck and back pains. Generally they're non-specific. There might be an underlying disc injury or facet joint injury. Majority of the time it's disc nature, but you wouldn't necessarily say that to the client, like I mentioned before, because you don't really want them to be anxious about it. Obviously, when people hear, I've got a slipped disc, it's really quite a scary thing, because my friend had a slipped disc and it was like the worst pain ever. And in actual fact, they could have had it for years. It's just flared up slightly recently. I guess in a more kind of sporty context, it tends to be like kind of shoulder impingements, and that can be kind of a mixture of things. It could be sitting too long at the desk, or it could be because you're an overarm athlete and you just kind of repetitively strain the injury, or sometimes it's compensation from another injury, say from the neck or things like that, and you've kind of tightened up around those tops of the shoulders. Obviously hamstring injuries, particularly with sportsmen, tend to be quite common, so muscular injuries, and a lot of the time, you know, this is an injury really you should look into more, because why has it occurred? Is it because a certain hamstring muscle's not working, or is it the glutes not firing correctly? Is it a length issue? And a lot of the time, you know, we do think hamstrings are bread and butter, but a lot of the time they don't actually fully heal and they kind of reoccur. And that's because, you know, like I said, you change the way that you run or you kind of compensate. So, you know, going more into hamstring injuries is a big thing.
These guys have seen in our common medical unit what a full hamstring tear looks like, and it's not pretty. You know,
they're bad.
It's basically black and blue by the end of it. And I was reading a lot of research recently about if you play on the wing in rugby and football, the chances of you getting a hamstring, I can't remember the percentages, but the chances of you getting a hamstring tear are through the roof compared to other positions. So.
Yeah, no, I think a lot of the time is because we don't necessarily train at those speeds. So for example, if you're a winger, you're going to be sprinting a lot of the time at 80, 90 and 100%, but we never really train at that speed, so you know, your muscles are not used to it, and then just, you know, one too many times and then that's it, boom, got that big strain. But there's also other things as well that can kind of play into it, stuff like hamstring length, because there's two types of hamstring kind of tears. You've got the lengthened version or the sprinter version. The majority, you'd rather have the sprinter version, the lengthened version. When you've overstretched, yeah, that tends to take a little bit longer.
Yeah.
But anyway, kind of digress on that. But other kind of common injuries, like I said, Achilles tendonitis, again, they can be tricky. Most tendon issues can be tricky, be it kind of patella tendons or tennis elbows. They tend to need a really big rehab kind of program, and that's where you guys can really come in and be helpful, because those tendons need to be loaded. Tendons love to be loaded within certain limits. If you don't load them, a lot of the time the injury becomes worse.
Yeah.
A lot of the time the temptation is, like I said before, to stretch it, and sometimes that can make it a bit worse. So obviously there's variability, it's not a natural blueprint, everyone's different, so you have to... Yeah.
Our context is always the key, and everyone has a different context, right? So what are your, for yourself, like, what have you found the most challenging in terms of injuries? Like, what should personal trainers really stay away from? And because obviously we have to work within the scope of practice and know our boundaries, how do we kind of develop that thought process, and what sort of injuries we go, well, we really have to just stay away from that?
I mean, I would stay away from more kind of diagnosing the patient, because even physio is kind of, in a way, kind of fear of diagnosis, because it's not necessarily we don't know what the issue is, or we don't know what the diagnosis is, but a lot of the time is tests can be kind of false negatives or false positives, sorry. MRIs can also be kind of you can show injuries but they're not actually causing pain, okay, or symptoms. So a lot of the time the diagnosis, because it kind of, like I said before, gives psychological issues, because they think they've got a problem, so they don't want to kind of do their normal daily patterns, and therefore they compensate and things become worse.
Yeah.
And yeah, so I would always kind of say, well, this is wrong, because that will install fear into people.
Yeah, that's a great point, and we're very big on staying within the scope of practice and not diagnosing anything, because we're not allowed to anyway. But it's also just the wording that we use. So you can obviously say to your client, this is what I see and what I think is happening, but you've got to be careful in how you word it, so that they don't think, oh, what does that mean? Does that mean there's something wrong with me? Or then you can also have associated pain, which is also psychosomatic, where they think that thing, like you said before about my friend had a slip disc sort of thing that was really bad, they're going to start feeling pain potentially. It does happen sometimes.
It does, and that's the thing, and it'll be in the back of the head, especially if they've got long-term pain as well. Like, a lot of the time, if injuries are long-term, particularly with the back, there is a big kind of psychological, kind of social kind of component to it, and there's generally more things going on in the background. So again, it's going to be one of those ones where you've got to use your words wisely, okay? And anything that can install fear, I'd say it again, just try to avoid, if that makes sense. And use your motivational interviewing, that doesn't really help.
Yeah, no, exactly, and just be careful with it, because I've learned my lesson and burnt my fingers a few times with this, because if you're like me and quite direct, sometimes you say something you're like, probably wasn't the best way of saying it.
I mean, like, we're all guilty of it. Like, you learn these things as you go through your career, sort of thing. Like, I've made mistakes, I know that for sure. I don't know which physio hasn't really, personally speaking. So, but yeah, that's probably one of my biggest. Is communication is pretty very, very big, especially when they're very client facing.
Yeah, absolutely. So how can personal trainers kind of make that referral process better, whether you're referring to them or they're referring to you? Because one of the conversations I had with the physios I work with elsewhere was he wants to refer out to PTs, but some of the PTs he's had, he finds it frustrating because he's given them a referral form to fill in, and all they've written in is this person has a sore knee, and he's kind of like, well, I don't know what to do with that, it's not really helpful. So
I mean, like, just, well, obviously give a little bit more detail than just a sore knee. Yeah, like, use your kind of knowledge of anatomy, or even knowledge of injuries or movements, or even exercise. So for example, you know, we've been training for the last 2 months and we've been steadily working towards X, Y, and Z, but the person started to get some, you know, lateral knee pain after doing, say, 10 squats at a certain weight, for example. Yeah.
So it's a bit more descriptive.
We've tried to change the load, but couldn't figure out anything out. I have an opinion it could be this, and then if you have any kind of other facts that, or they might have tight hips or reduced range around the ankle and feet, or they've suffered from lower back pains before, you know, just giving a bit of a background. In a way, more the merrier.
Okay. And we're generalising a little bit now, but are there any exercises that you particularly don't like for the general person, and any that you want to see more of?
Any exercises I don't like?
It's just like there's no in most contexts.
I mean, there's a lot of exercises I don't like how people perform.
Yeah.
Yeah, it's not necessarily I don't like an exercise, because I feel like every exercise has its purpose. Obviously, if you do something too much, your body's going to react against it, if that makes sense. So you don't do anything to balance it, then you're going to get problems. I'd say form is probably one of the biggest things. There are some physios out there that say, well, if it's not painful, then it shouldn't be, you know, it shouldn't be a problem. I kind of disagree with that, because I feel like if you do something enough times in the wrong kind of way, you're going to put too much mechanical stress through it. I would say I go with squats and deadlifts, and obviously they are very, very good exercise, and I do them myself. Again, go with kind of form, but sometimes it's about the program on loading, if that makes sense. So it's more about loading it gradually, because obviously these kind of put a lot of stretches through the spine, not just the lower back and the hips, but also the upper back as well. For example, if you have a lot of strength around the tops of your shoulders, you could end up setting off some neck pain or some shoulder pain. So it's about gradually loading it so that they don't end up going too far and then boom. But you could make an argument for any kind of any exercise. If you go one step too far, you could get an injury, if that makes sense.
Yeah, absolutely. And I think really we've had a conversation on a previous talk that there's no exercises, in our opinion, that are inherently bad or good. It's always just the context in which you use them, and there's only less appropriate and more appropriate exercises.
And the reason why I bring up the deadlift and the squat is because people tend to go, they really load up.
Yeah.
There's the temptation to load up, like a bit like the bench press as well, just because they kind of those lifting exercises in a way.
So you get clients, it's like, oh, well, I deadlift 123, and then they come back and I'm like, we're doing 30, and they're like, what? So I need you to do 30 kilos, and like,
exactly.
What do you mean? I do 120.
And the temptation is there, so you should really kind of push it, and sometimes that is another thing to educate people, you know, because if they end up picking an injury and they're out for 3 months, and they're going to come back to the.
Because one of the biggest things I get from the practitioners I work with is clients really struggle with load management, and it's just you end up going round in a circle on that one, don't you?
And that's the thing. Like, people always focus on the short term, never the long term. And yeah, that is it's even difficult in my
Yeah.
in my field, just trying to get people to load up slowly. We sometimes have to start with some really boring exercises, and then then we have to be like, don't worry, we'll get there. It's going to take a bit of time.
Because people traditionally find rehab a little boring, don't they?
Yeah.
So
Yes, that is true. But I do think you like, it depends on the physio. You're kind of limited to your kind of imagination.
yeah, absolutely.
Particularly with certain exercises, just when you get a little bit later on, you can make things a little bit more fun. If
Yeah.
that makes sense.
Because it's about the delivery and the engagement and all that sort of stuff.
Exactly. And I think if you make things hard for people generally, then like a little bit of if it's in their kind of like bracket,
Yeah.
obviously everyone's a bit different. If you can get that right level, then people will like it. If you go too high, they won't like it. If you go too low, then it's not going to be.
Because one of the things that we've had as personal trainers is say they had this physio, they got the exercises, and then you're like, well, did you do them? And you're like, I did them for a week and then I stopped. And it's just trying to. The better the physio, the less that happens. But again, it is something that still happens.
And it's because a lot of the time, because you do see is that exercise is a new thing for people and it's challenging and it's tough to actually do. So to actually get them motivated is the real kind of skill in that one. So hence the reason why I like using you guys, because you're that kind of helping hand, and like you put the arm around the shoulder and say, look, we can do this. And you're going to help them do their exercise or their rehab in a way. Yeah.
Because we get it with PT as well, right? Have you done your program this week now? So
it's going to be always an ongoing thing. I just think you just got to, the more that you see someone, the more you learn about them, the easier you'll find it to motivate them, to see what they makes them kind of tick. Again, like I mentioned before, motivational interviewing is really good.
So just on that motivational interviewing, so we've got a big section on that in our consultation side of it. So really digging into the why behind people's goals and their move to way of thinking, and really understanding how their brain sort of works, and like you said, how they tick, because everyone's different. For a lot of people it's avoidance of, well, I don't want that, as opposed to, well, this is what I want, and there's two very different things in your head and the way your brain will pick up on it.
I totally agree, because I use it in my practice, because a lot of the times if you're seeing the first consultation and someone's in pain, a lot of the time there might be an underlying kind of social issue going on. So you've got to sometimes pry that out to feel like, what could your barriers be going forward?
Yeah.
And then it's also about, if I just go, well, we're going to do some exercise, or we're going to do this, it tends to make people kind of respond poorly. Like, sometimes you can get heated kind of exchanges at times because someone's in a lot of pain and they just want you to solve it. But sometimes if you ask the right questions, you diverge a little bit further, they'll start opening up to you, and then you can start really kind of pushing them and educating them why what we do is important.
Yeah, and I've also find tapping into all that kind of more emotional side of things as well can often make them not focus on the pain so much, because they've kind of had a weight off their shoulders, and it kind of reduces it sometimes as well.
Yeah, no, definitely, I totally agree.
So yeah. Okay, cool. So just to kind of wrap this up then, what would 3 takeaways be for you, for PTs and fitness professionals, from the whole kind of injury side of things, through to everything we talked about? If you were to sum up 3 key points, what would they be?
So first of all, obviously we talked about communication is probably the biggest thing.
Yeah.
So that's obviously educating them about injuries, not necessarily diagnosing them and saying that there's something inherently wrong. Communicating between the physio and the PT themselves, and like educating them on certain exercises and things like load management.
Yeah, I think load management is always going to be
load management is a big thing, which actually I would put in its own kind of category as one of the biggest things.
Because there's this, and then there's load management, which is always up there.
And that's the thing, like load management is obviously you've got to keep the person interested but not causing an injury in a way.
I think sometimes as well trainers can get a bit too lost in the technicality. It's like, well, great, this is great on a technical level, but they're only going to do 20% of it, so don't worry too much.
And I do find that's where like goal setting becomes a really big point. Just trying to get someone to, we want to get to this point sort of thing, because then we can keep working to it, and then you don't go off on a tangent, because you always have that kind of, and then you can get your load management.
Like what's the priority, and stick with that and work with.
Exactly.
Yeah. Okay. Cool. And just so these guys, because obviously you're contributing this to our course, and we really appreciate it. Like, if you're based where at the moment?
So our clinics are based around London. So we've got a clinic over in around Bank, in the City of London, Canary Wharf, High Street, Kensington. No, sorry, South Kensington.
It's close enough.
Close enough. And Cavendish Square, which is near Oxford Circus.
Yeah. And if someone wanted to reach out to you, so say a PT off the back of this wanted to build a relationship with you or another physio, how could they come and potentially do that?
So if they ping me an email on at Karl@rebuildsportsclinic.com.
Karl with a K.
Karl with K, yeah, very good. They can search me off LinkedIn and stuff like that. Give me a personal message. Just search Karl Khan and I'll be there. You just ping me a message. I'm happy to ask any kind of questions about any clients they have, or if they want to form a relationship.
Yeah, absolutely. And are there any, just one last thing, are there any resources that you know of that people could potentially go and access that might be a good thing to kind of develop their skills at the back of the course?
Resources. I mean, the internet. I mean, I'd always look for research papers, if that makes sense. And look, if you've got a patient, a client with an injury, go and research about it. Look at the up-to-date kind of research. Yes, YouTube has a lot of information that's a bit airy-fairy and a bit gutsy, but then there's actual people that have done presentations who are professionals in those fields, and you can actually find some great content on there. But yeah, research papers, reading just textbooks on injuries, for example.
Yeah.
And there are a few portals for physiotherapists, which I don't think I should actually name.
You don't need to do that.
But for physiotherapists that will kind of give you a little bit more info on what we do, sort of thing. But the research papers are the biggest hand in hand.
Because we're quite big on things like PubMed, BMJ. We also use Lancet for things like nutrition. But obviously, for some of these guys that don't come from academia, they might not necessarily know how to read research and so on. So, are there any particular books that might be useful? Someone recommended Kelly Starrett's How to Be a Soft Leopard, for example.
I mean, for general sports injuries, I can't remember the book's name. It's called, I think the authors are Brackner and Karl, ironically. Yeah.
You didn't write it, though?
No, I didn't write it, unfortunately, which is actually the book that most therapists tend to kind of start with, and it gives you kind of a few diagnostic tools, a few things that you might need to do for certain injuries or certain pains, and it's, I would say, probably the kind of encyclopedia for sports injuries.
Okay.
And there's always a new edition popping out. So yeah, I personally would recommend that first of all as a good kind of go-to. Books, what I'd say is quite good. I would stick with that first of all, because then once you've found an injury, it's more about divulging yourself into it. There's no real specific book for specific sort of injuries, because everyone has their own take on it, and the thing is, in our healthcare, is everything's kind of moving away with it. There is a guy called, for back pains, Peter O'Sullivan, that kind of focuses more on kind of the psychosocial issues and motor control and more movement, which would be quite handy for you guys.
Yeah. Alright, good stuff. Any parting words just to finish off?
No, you guys, I wish you all the best, and I hope it goes well, and good luck for the future.
Good stuff. Thanks for your time.
Thanks,
Karl.
Chris. I really appreciate it, mate.
Nice.